My name's Debbie Ludlam and I'm the Engagement and Participation Manager for Brighton and Hove CCG and High Weald Lewis Haven CCG as well. We engage with diverse communities across Brighton and Hove in sort of a number of ways. I think one of the really good ways that we do this is working closely with our community and voluntary sector organisations within the city. So working with organisations that already have an established relationship with certain diverse groups, because we know from our sort of equalities monitoring that actually there's certain groups of people that don't historically talk to the CCG.
My name is Michelle Gavin and I am Projects Manager for an organisation called Friends, Families and Travellers. The inspiration came quite a long way back actually, probably around 2003. We were going out and doing assertive outreach to Gypsies and Travellers across Sussex. What we discovered, of course, and over the years, and we've developed on, is the fact that you have to start where people are. If you go out to a site and someone is possibly having lots of health problems, or they can't access a school, or they're having problems with their benefits, the last thing they want to talk about is giving up smoking. It's not the right time for them. So what we did is we developed a listening ear and really worked with the traveller community to find out what was important to them and at the right time. What we discovered is we wanted to develop an asset-based approach, and that is by being community-led and being able to offer a qualification or a project that was able to fit in with the community.
Mental health is one of the challenges. We call it bad nerves. We don't say mental health amongst the community, it's called bad nerves. But mental health is a challenge. People with heart disease, that's another big challenge. A lot of gypsy people's got heart disease.
It's been a real success in Brighton, and it was very innovative of Brighton CCG to run forward with this. And it's basically, it's the equality groups within the Brighton city. We work together to ensure that each strand that we work with, or the group of community that we're working with, ensures that the CCG have the information and intelligence to actually ensure that they're being looked at so the services can be designed with them in mind.
I had one heart attack and I was not prepared to have another heart attack. I went a couple of months ago, before I started this course. I don't think I could speak to you properly without coughing or choking.
One way of making sure that engagement happens is incorporating it into our equalities and health inequalities assessments. So this is sort of an in-depth assessment to try and pick out any health inequalities or equality issues that may arise from a change in a service or a new development, things like that.
We realised that many young people were being overlooked in this type of educational programme, and that is to able to support peers within their communities to make the appropriate changes. Many children have missed some levels of schooling, so they weren't getting the public health messages that were in the school.
So some of the young people, when got the chance to deliver a health message in one of the modules, picked very culturally relevant health messages. So one of them, for example, was sunbeds. They were expressing a lot of their mums have sunbeds quite frequently, and they didn't know the dangers of it. So now they pass that message on to their parents and their peers, and now the younger generation are completely against sunbeds, and it's kind of rubbing off on the older generation as well.
Some of the key learnings that we found, especially sort of around the sunbed project, is that it can be sort of having a tan is quite related to cultural issues. So, for example, it's a sign of happiness, health and wealth. So we need to be sort of a lot smarter in the way we sort of approach some of our communications around the dangers of sunbeds.
Everybody at FFT is trained to support health improvement messages throughout each visit, so it's part of our daily business. And during those talks, we're able to say, would you like to go further with that and take some training and qualification?
If I can help one person change his mind on a subject, or help another person on a different subject, that's a good result to me.